From a filling station here on the N1, where the Department of Health, of course, is on the campaign here to try and encourage motorists to take rest on their journeys to various destinations, but also making that awareness for them to take care of their health. There is a mobile clinic that is set up here, of course, for people to come and access health services, but also I can see there are various stakeholders that have come out here to come and assist, that are on board rather, with the Department of Health. I want to bring in one of the stakeholders from Lifeline just to talk about what kind of services are you offering here.
Good morning. At Lifeline South Africa, we offer free telephonic counseling on mental health and emotional wellness. Not only limited to that, but we also offer counseling on gender-based violence and educate the community about the knowledge on GBV, knowing about the signs and the processes on how to report it. We also have a line on the AIDS helpline. On that, we assist the community about anything to do with health. One needs to know their health. We have a nurse online also where they can contact us 24 hours.
But here, when motorists are passing, as you are here, are you able to offer those services, or what happens?
We are able to offer the services because we did bring our counselors as well. Other than that, we are also raising an awareness on taking care of your mental health while traveling, because rest, if one does not rest their body, it will eventually affect their mental health, and also that could lead to one doing what? Causing accidents. So rest is important for so that they can be able to function correctly.
I see it's still quiet. Is it your first time coming here? If it's not, how have people responded to the services that you are providing?
Actually, it is not our first time. Usually during Easter, we go to different garages around the Gauteng areas where we also interact with motorists and encouraging them on taking rest and taking care of their mental health.
But how are they responding to your services? Are they coming forward, or do you have to go and just...
Usually we approach them because they are not aware of our existence when we are at the garages. So we approach them in the cars when they go to the shops as well. And we also give them some freebies where we have our telephone numbers on, like your lanyards, your key rings, your bumper stickers, you see, so that they can be able to contact us going forward.
Well, thank you very much. That is Rehab Ntabi from Lifeline here, talking about some of the services, of course, that they are offering. Is one of the stakeholders that I see here. But there are a lot of services that are being provided here, as we can see, Ayanda behind me, some of the services that they will be providing. But it will be interesting, of course, to see what will happen when they go and approach people, or when people start coming in, because I can see that the filling station is very busy, but I haven't really seen many people coming out here to access some of the services that are being offered here, because there's also a mobile clinic where people can be able to access the clinic and be able to get some of the services. They did indicate earlier on, the Department of Health, when we're talking to them, that they will be able to even offer a medication. If you come in into the mobile clinic, they will be able to test you and also give you assistance in terms of the medication. They did also did mention that they will be providing services such as even HIV testing. Of course, you will be able to get the testing kit and go and test yourself in your private space. Of course, the Department of Health did indicate that they are targeting motorists as well as drugs, because many of them will be stopping by here to take a break. So those are some of the activities that are happening here. But it will be interesting, of course, to see when people start coming in numbers, to see what will be happening here, as they are offering various services here as the Department of Health.
All right, thank you so much. That is my colleague there, Makgala Masiteng, out in the Free State for us.